G'day, my name's Daniel Miller. I work for Health First Group Gold Coast. I've been a physio ongoing for about 18 years. In that time I've used lots of different modalities. I've used laser, ultrasound, but what I've found is Shockwave to be a really effective tool in helping manage a lot of pain and different issues with all my patients. I've used this quite frequently for a number of different conditions, so through things like bone spurs, bursitis, tendinopathies. We've had really great results in short amount of time. So a lot of the time, even within the first session with patients, we will note some improvement in their pain and their function. Most of the time we find that with this sort of treatment, we'll probably be looking at about 4 to 6 sessions to get some noticeable long-term results. The treatment itself is something that's based with a head of the gun machine, working through different areas of the body, so it's always quite accessible. We will use different protocols depending on the area and to try to tailor the best effect for you. So every treatment for everyone is a little bit different depending on their needs and their wants when they come in, or the things that we assess when they come through, working out their dysfunction. But in regards to the effect of the machine, it basically works by creating a bit of micro-trauma through the tissue, which is good for creating a bit of an inflammation response. Now, people hear about inflammation thinking that's a bad thing, but actually it's an important part of healing, and it's a process that needs to happen well at the start to have the best outcomes. We see a lot of patients with a lot of chronic pain and problems that have been ongoing for years. They've had a lot of what we call like a bit of disrepair. So when the tissue reacts, it inflames, it heals poorly. We'll find that a lot of the tissue will start to thicken, become irregular, pain insensitive. And so when those patients try to go out and do activities, they find that their pain limits their ability to get strong and get fit again. So we find that the Shockwave is a really good process to help with the remodeling of that tissue, to help with improving blood flow, to re-stimulate that initial inflammation response, which then helps them to get back on track with their healing. So with the machine that we use specifically, it's the Gymna model, and I've been using this now for the last couple of years. Found it reliable, it hasn't skipped a beat, very robust. It has very simple little protocols. It will have areas to treat, so you can set specific areas and it will have the programming done for you. You just have to set the intensity sometimes, or the duration, frequency, but it will give you a lot of the recommendations of what area you're treating. So it makes it a very, very simple process. As I said, everyone that we see, we have to tailor the treatment to that person. So having that flexibility where we can choose the program that's appropriate for the person, but then to be able to adjust it depending on how they're feeling through their treatment. Most treatment sessions, will happen within that 20-minute consult that we have. So it's quite an effective tool. Combining that with some other aspects of exercise. So we've got many practices around Australia, and every practice has a Gymna type Shockwave, because again, we found that very reliable, robust, easy to use. I would highly recommend this machine for all practitioners to help with some of those acute onset pains, to help start that good inflammation response, all those chronic type patients who've been long-standing pain for more than 6 to 12 months. They've seen every other type of practitioner in physio. So I end up seeing a lot of those type of patients to come here to help them to get past that hurdle that they've been having for quite some time. They've seen podiatry, they've talked to the doctors, they've had injections, all that sort of stuff. So the benefit I feel for this is this has a real physical response to the tissue, creates mechanical energy, which creates that micro-trauma. So in a way, it's a way to deeply exercise the tissue to get the desired inflammation response and to re-stimulate the healing in the tissue.